Welcome back. It's Dr. Van Dyke here with part 4 of diabetes education. So let's get to it. In part 4, we're going to cover complications of diabetes and the best ways to prevent them. We've kind of touched on this already about how early aggressive interventions, both in lifestyle and with medication, give us the biggest payoffs later. So, diabetes complications arise from having too much sugar in the body for an extended period of time. And remember, we discussed how this begins in the pre-diabetes phase. You have higher risk for heart disease and stroke, and we have began touching on the steps you can take to lower your risks. So the nerve problems, or diabetic peripheral neuropathy, is caused by high blood sugar. It can affect the feet and legs, hands and arms. Remember, we talked about how this was the stocking glove distribution of neuropathy. And it can also affect the stomach and the bladder. So have you heard about diabetic gastroparesis? This is diabetic neuropathy of the vagus nerve that controls how our gut moves. So if the vagus nerve is impaired, then we have poor motion of our gut. We can't push food through the gut very well. So patients who have diabetic gastroparesis have a lot of problems with nausea and vomiting and even difficulty swallowing when their gastroparesis is advanced. In terms of bladder, there can be problems with emptying the bladder completely. There can be problems with loss of urine. It's variable and is also closely related to the sexual side effects that we touched on in part 1. The warning signs of peripheral neuropathy can be numbness. You don't feel heat, you don't feel cold, you don't feel pain. The feet can feel numb, that kind of my foot is asleep feeling, pins and needles kind of things. You could get sharp pains that kind of radiate up through the feet into the legs. Patients typically complain that the symptoms are worse at night, and it does impair their ability to sleep. And I just want to underscore a case that I saw a year or so ago that really drives home how important peripheral neuropathy is. I saw a young lady in her 20s with a type 1, a very advanced peripheral neuropathy, and she actually fell asleep in her chair when there was a space heater on near her feet, and she could not feel it as the space heater began to burn the skin off of her legs. And so she ended up in a very, very precarious situation, and she had to live in a nursing home, and it was very devastating for her functionally and medically, and it was very, very distressing for her parents. So again, I'll underscore the importance of early aggressive intervention so that we don't ever have to deal with problems like this. Footnotes, how cute. The do's and don'ts of your feet. So we definitely want to keep feet very clean. We wash them every day. We keep them very dry, using lotion, sometimes Vaseline as needed, to keep the skin on the feet soft. We don't want these hard calluses forming because they can crack. And when the skin cracks, then cooties can get in there and cause infections. You always want to wear good shoes that are comfortable, that don't rub on your feet and cause blisters. Cut your toenails straight, but always keeping an eye on your feet every day. We never want patients to go barefoot, even in the house. I want you to wear a slipper of some kind that has a real sole on it. A hard sole is preferable. We don't want people using heating pads, water bottles, or in the case of my patient that I saw, space heaters, close proximity to the skin. Never want anybody performing surgery in their own bathroom because, again, cooties get in and then we deal with really deep infections, and nobody wants that. Skin complications, you always get warning signs before things go crazy, right? So the warning signs are dryness, redness, maybe pinpoint bleeding. This would escalate to infections. Maybe symptoms could start with itching, rashes, bumpy skin at insulin shot sites. If you get any of those symptoms, whether they're on your feet or anywhere else on your skin, pay attention to them. Bring them up when you see your doctor. If we fail to treat the skin complications appropriately, they can lead to really significant infections. And part of the exam that I always do on patients is inspecting their injection sites, making sure the skin looks okay, that there aren't hard spots building up. Skin conditions at those sites can affect insulin absorption. So, for example, people sometimes get in this habit of giving their insulin shot in exactly the same place every time. And we don't want them to do that. Insulin wants to go into fresh skin every time. If you continue to give the shot in one place, it becomes less painful, but that insulin also kind of builds up, and it can create thickening of the skin, which prevents the insulin from being absorbed. And you could end up with this little golf ball of insulin in there. And the real bummer is that eventually that thing is going to let go and it's going to be absorbed, and you're going to go down like a sack of potatoes. So we don't want that. Fresh spot, fresh insulin site every time. That's how you absorb it best. You always want to get your money's worth from your insulin. So what can you do as the patient? Always checking your skin for wounds, always keeping everything clean and dry, using lotion if you have any dry spots that are causing problems. Always use a mild soap. Dove is a great soap. CeraVe is a good soap. Cetaphil also is a good soap. And we want to keep that blood sugar controlled, right? Hit that mark 80-85% of the time. Other nerve problems. We talked about stomach and bladder a little bit. Food moves too slowly, too quickly. You feel nauseous. You have vomiting, diarrhea, constipation, frequent bladder infections because the bladder can't empty all the way, and an inability to recognize when the bladder is full, and that's what leads to unplanned loss of urine or incontinence. In the eyes, remember, the eyes and the mouth are the windows to your body's health. So in your eyes, diabetic retinopathy is the most common cause of vision loss among diabetes patients. And this drawing is a nice example of what that kind of looks like. So here's a normal eye, nice clean vessels, nice smooth background, okay? In diabetic retinopathy, the vessels themselves can get kind of crinkled looking, and you get these yellowish spots and these reddish spots. And we called these ketchup and mustard stains in medical school. But the yellow spots are called cotton wool spots. They're deposits in the eye. And then the red spots are little bleeding points and aneurysms, little hemorrhages and stuff. So how can you tell? Symptoms, patient can be asymptomatic actually early on, and this is why I'm always telling my patients, every diabetes patient gets to visit with the podiatrist for their feet and with the optometrist for their eyes every year, no fail. Some symptoms, you can have floaters or somewhat blurred vision, and that's why we want to do a full dilated comprehensive eye exam every year, okay? Prevention and treatment. Optimal sugar control, we know this. Early detection can reduce that risk of blindness by 95%, and that's why we do this every year, dilated eye exam. And if you do have retinopathy, then you go to an ophthalmologist, and there are a lot of treatments that they can do. They can do lasers, they can do injections into the eye, and that can really buy time and control the situation. All right, the mouth, your other window to the soul. What does diabetes do to your mouth? Periodontal disease, big time. You get damage to the gums and the bones that hold your teeth in place, and then you end up with chewing problems. And so if you can't eat well, it makes it difficult to control your blood sugar. You can have high blood sugar that becomes high saliva sugar. And if that happens and you have poor oral care anyway, you end up with an infection of yeast in your mouth that's called thrush. Okay, thrush. And that takes medication to deal with. It can be very uncomfortable, and sometimes it infects the esophagus as well. So, what do? Control the blood sugar, right? We know this. Brushing and flossing every day, visiting that dentist twice a year, at least once a year. Let them know that you have diabetes. Let the dentist know if your gums are sore or your teeth feel loose or something's not right with them. And if you smoke, stop smoking. Absolutely. There is no cell in your body that can escape the deleterious effects of a cigarette even once. All right. But if you smoke and you're having problems with your oral care because of diabetes, smoking is going to make gum disease worse. All right. Sexual health complications for the ladies. High blood sugar ruins your libido, makes you feel tired, you get vaginal dryness, makes intercourse uncomfortable, and actually there's a very strong correlation among diabetes patients with depression. And of course, if you feel depressed, your libido is not going to be good. Of course, you can have reduced interest in sex if sex is painful, or you're having a lot of yeast infections, or it's more difficult to achieve pleasure during sexual intercourse, all related to the long-term effects of diabetes. For the guys, uncontrolled blood sugar also makes you feel fatigued, can also have the depression and less interest in sex, poor libido, erectile dysfunction. We touched on this in part 1. That's damage to the nerves and arteries in the penis, which disrupts the blood flow, so erections are less effective, okay? But anytime we're seeing erectile dysfunction, we need to consider that heart disease is also present, okay? These things do not exist in isolation, right? This finding of sexual dysfunction is more common if you've had diabetes for at least a decade. Okay, again, underscoring that early aggressive intervention and strong lifestyle efforts are going to pay off the best in the long run. All right, life hacks for the sex, right? Control the blood sugar. Oh my gosh. Talk with your partner, work together, improve your communication. If your partner is not diabetic, his or herself, they need to understand all of these components about your diabetes so that you can brainstorm solutions for each other. If you have a psychological connection to this problem of sexual dysfunction, seek therapy. It's okay. They're there to help you, right? You don't want to have to live like this if you don't have to. Consider oral medications. These are things like Viagra. That's what your friendly endocrinologist like myself can do for you, or even your primary doctor. Make sure blood pressure and cholesterol are optimized. I would say not just managed, optimized. That's when we know we're doing our job right and we're being sufficiently aggressive. And then, as always, I beg of you, never smoke. If you smoke, stop smoking right now. You will not regret it. Take steps to lower your risk. Putting off preventing diabetes complications. This is how we do it, being early interveners in aggressive ways with optimal medical management and all of the support that you need to do well. So this takes time, right? Like I said, we want to manage expectations. It's not appropriate to think you're going to nail this in the next 4 weeks if you're a brand new patient with diabetes. Okay, take the time that you need. Use the support structure that you are given. Your dietitian, your diabetes education, your podiatrist, your optometrist, your primary doctor, your endocrinologist. Communicate with them all. Use every resource that's available to you. Having intellectual curiosity about diabetes is going to be so useful to you. Read everything you can get your hands on. Bring it in. I love to see when patients bring new information in. Sometimes you guys get a handle on it before I see it. So that's good. And then you're going to choose your treatment plan with your team. And that plan is going to be something that's going to fit into your life, that makes sense for you and is sufficiently aggressive. So I will underscore again the need for intellectual curiosity, because the person with diabetes who knows the most will live the longest. And I will add to Jocelyn's statement there that they will also live the best. Planning for illness. This is tricky, okay? Let's start here. You get sick, you have stress hormones, your body makes cortisol to cope with the illness. And it does a couple of things all at once. So it's going to signal to the liver that it's time to dump sugar into the bloodstream. We're going to use up all the sugar that we've stored. Okay, dumping it into the bloodstream, high blood sugar. Simultaneously, cortisol is going to talk to the other muscles and tissues in the body and decrease sugar uptake that contributes to the high blood sugar, right? So instead of sugar going into cells to be used, it's staying in the blood. It's not being taken up by muscles. Muscles can have some breakdown as well, and so you'll have amino acid breakdown. Now, you have fat stores everywhere, and in a stress situation, it will undergo lipolysis. So they begin breaking off components to end up making more sugar sources, other food sources for the body. So you end up with another contributor to high blood sugars and more fatty acids. Okay, complicated scenario, but it's important that you understand that the base is that cortisol triggers a bunch of different responses in the body. So when do you want to talk to your doctor? Well, when you have fevers above 100.5, that's genuine, that's a real fever. If you're having vomiting or diarrhea for over 2 hours, that matters because you won't be able to take meds. Obviously, it's going to be hard for you to deal with blood sugars and insulin dosing if you're not eating. If at any point your blood sugar has gotten to 250 or higher, and it's done that 2 times, even if you've given insulin and it hasn't responded, definitely got to call the doctor. If you monitor your urine, you know, this is one of those things that we talked about early on in part 1 about ways to monitor sugar. You know, you can monitor your urine for ketones, which is a suggestion that you might be getting into some dangerous areas with diabetes control. Most people don't do this, okay? But again, if you find that you have ketones in the urine, definitely let us know about it. Your plan for illness includes a special meal plan for when you can't keep foods down. You know, this is the role that things like Gatorade may have to play. Always take your medications if you can keep them down. Check your blood sugar at least 4 times a day. Keep a journal. This is what I said. I love it when patients bring in data. Drinking a lot of sugar-free liquids to prevent dehydration is really, really important. Want to keep you out of the hospital. And you may have to switch to regular sugar-containing liquids if your blood sugar is starting to come down, and that's that Gatorade role that I talked about. So that's it for part 4. That was quick and dirty. And we'll come back for part 5.